This podcast is for general informational, educational purposes only and is not to be considered medical advice for any particular patient. Clinicians must rely on their own informed clinical judgments when making recommendations for their patients. Welcome everybody to another episode of PHM from Pittsburgh. I am your host, Dr. Tony Tarchichi. I'm a Med-Peds trained pediatric hospitalist at UPMC Children's Hospital of Pittsburgh in the Paul C. Gaffney Division of Pediatric Hospital Medicine. We are here at PHM for our final episode from PHM. This is our final What Did I Learn Today at PHM, and the last episode I'll be releasing from the conference. The conference has been great. The people have been fantastic. Seattle's a great city to visit. Now, today, what I learned, I didn't go to a lot today because I've been editing these episodes, but today I did go to a session on some of the QI research that has been done, and Dr. John Smuziak and Andrew McCormick actually talked about research they had done where they increased billing and decreased length of stay on their inpatient floors by instituting a QI project where they added a hospitalist, because during the evening time there was one hospitalist, they added a second, and that allowed them to capture more billing for the patients that were just waiting till the morning. They decreased their length of stay for their bronchiolitis patients, and they increased hospitalist satisfaction because their workflow decreased. Everybody won. So that was great. Today's episode is with our community hospitalist colleagues. Everybody here is a community hospitalist. We're going to do a round robin again. They will introduce themselves and then where they work and what they learned today at PHM. And we will go all the way around. So without further ado, let's get our first guest on.
Thanks, Tony. My name is Eva Schwartz. I'm a pediatric hospitalist at Methodist in Minneapolis, which is part of the Park Nicollet system there. When you asked about what I learned today, there are a couple things that I think represent kind of the experience that we have here at the conference. Sometimes it's very specific clinical knowledge. Like I went to a session today that was about newborn procedures, and we learned about tongue ties and kind of how to judge those. For anyone who does newborn medicine, you know that there's always controversies with tongue ties and who has one and who to clip and how it's going to help. And she gave us a really nice example of an actual objective tool to use to quantify like how bad the tongue tie was, called the Bristol something tool that I've already forgotten, but that's enough words to Google it, and you could probably find it, just to give you a little bit better of an idea of how severe a tongue tie actually is and if it may be helpful with breastfeeding outcomes to actually clip it. So that was really great. I like that. And then this morning I also went to a session that was called, I think, Beyond RVUs, about neonatal hospitalists and kind of talking about our value in the system and also how to kind of promote ourselves and provide high-value care to newborns. And I really like going to those kinds of talks as a young physician because I learned so much about coding and billing and kind of how to promote yourself in a hospital system, which when you're a young physician, especially going into the community hospitalist world, you don't necessarily have a direct mentor or somebody to teach you how those hospital things work. So the few years I've been at PHM, I found it very helpful to go to those kinds of sessions, and I've really learned a lot about how to not only be confident and promote myself, but kind of how to work within a hospital system that oftentimes is not a pediatric hospital, but an adult system that's not always paying attention to the pediatric world all the time. So I liked that session a lot today.
Well, that was great.
Hi, everyone. I'm Peony Lu. I am a pediatric hospitalist at Kaiser Permanente in San Diego, so a big city community hospital. And so my favorite sessions are always the clinical sessions. This morning I attended a session on refeeding syndrome, and we definitely do our share of eating disorder patients and kind of refeeding, reintroducing calories. And I learned for the first time that there is a criteria called the NICE criteria that I'll start including in my notes. And it's basically a way to stratify. There's like major criteria and minor criteria, kind of like Jones. And there's a way to kind of see if your patient is high risk for refeeding syndrome. So that was super useful, and I'll start including that in my documentation from here on out. And secondly, one session I always make sure to attend at PHM is the top 10. This is a review of the top journal articles or the most seminal or impactful journal articles of the last year. And in this year's top 10, I learned about the role of procalcitonin in helping stratify low risk or babies at low risk for serious bacterial infections who are less than 60 days old, who are febrile.
That's great. And we just released another episode on procalcitonin. For those of you listening, you can download and listen to that as well.
Hi, my name is Ashleigh Welko. I am a pediatric hospitalist at Banner Health in Mesa, Arizona, so another larger city community hospital. And today I learned primarily at the top 10 papers lecture earlier today that probiotics, which I know the use of probiotics in the hospital setting is more or less controversial. Does it help? Does it hurt? And there are a lot of clinicians I know who really stick to their guns and love their probiotics for the treatment of diarrhea in the hospital. But there was a paper that reviewed both studies with the PCAR network out of Canada and the US, which showed that there is no difference in using probiotics for infectious diarrhea in the inpatient pediatric population in any of the 4 criteria that they measured. So they looked at their clinical severity scale for gastroenteritis, the Vesicari scale. They looked at the duration of vomiting, the duration of diarrhea, and the number of kids who actually got admitted, and the use of the lactobacillus rhamnosus, and there was another lactobacillus they included as well. That doesn't actually decrease any of those. It doesn't decrease the severity of any of those factors on any kind of significant level.
That was great. Thank you.
Hi, everyone. My name is Janice Falco. I'm one of the pediatric hospitalists at St. Clair Hospital in Pittsburgh, Pennsylvania. This morning, the most important talk that I think I attended was on infant circumcision. Mostly it was going over some of the contraindications for circumcision, which many of them were reviewed, but some of them were new for me. So they reviewed that Cordy, hypospadias, bilateral undescended testicles would be contraindications, as well as some disorders of the rapha, and they went through what was okay to circumcise and what you should send to urology, with kind of an emphasis on if you're not sure, just send them to urology. They also reviewed some complications related to circumcision, such as bleeding, and as well as what to expect with the healing process that I think it's important to counsel families on. The other session that I found really helpful this morning that I enjoyed was on somatic disorder, and the emphasis was on to destigmatize the psychiatric role and to bring up the diagnosis early on in the conversation.
Well, that was great. Thank you all very much for joining us today. I really appreciate your time. I'm glad you enjoyed the conference. Thank you for joining us.
Thank you.
Thank you.
Thanks.
So we're going to wrap up and do our acknowledgments as usual. Thank you to the AAP section on hospital medicine for asking us to do this, and the University of Pittsburgh and UPMC Children's Hospital Pittsburgh for supporting the podcast. Thank you all for listening at home. It has been fun doing this. It has been more work than I expected it to be, but I have enjoyed it, and I hope you all enjoy it at home. And otherwise, take care, and we'll see you when we're back in Pittsburgh.
Thank you for listening.